at the Murchison building talking to Senator Richard Burr about our health care in North Carolina. Both Richard Burr, Tom Tillis, and David Rouser told us this week that our health care costs are forcing insurance companies out of the market. But their CEOs, Aetna, is in the North Carolina market. Their CEO took a $27 million pay last year in salary and bonuses. Blue Cross Blue Shield CEO got $110 million in CEO pay and bonuses last year. Are rising healthcare costs paying for our healthcare or paying for bonuses?
Thank you, Sarah. Maud Kelly.
Hi there, my name is Maud Kelly and I live here in Wilmington, and I'm here to talk about the patient's perspective. I'm just a regular, hardworking American mom who was diagnosed with ovarian cancer in 2009. Luckily at that point, my husband had a good job, so we had health insurance. Then I pretty quickly realized, gosh, I better have health insurance on my own because this was before the ACA. So I got myself a good job and had health insurance. Then I got sick again for the second time. And I kept working so that I wouldn't lose my health care. And then in that time, the ACA was passed. And I thought, oh, thank God, if something happens to me, if I get sick again, if I relapse again, then if I have a recurrence again, then I will be guaranteed health coverage, even though I have a pre-existing condition. So when I was diagnosed the third time last year, I finally had to stop working so I could be with my family, take care of my health, and take a chemotherapy medicine that I take every day that is doing really well. I'm doing really well, but I'm very tired and I can't work, right? Like lots of people who are sick and struggling. But since the election and since the specter of guaranteed coverage for people with pre-existing conditions has been looming, I've been feeling less like someone who is going to be able to conquer an illness and more like someone who is being forced to walk a plank. And so what I think is that if this bill is passed, then what it's saying to regular hardworking Americans is that even if you're healthy, you're going to be walking a tightrope. But God forbid, if you get sick or if you're born sick, well then you might as well be walking a plank. And I just don't think that that's fair or right in this country. Thank you.
Thank you, Maud. We're with you, Maud.
My name is Dr. David Schultz. I'm an internist here in Wilmington. I'm just going to read the letter that I'm sending to Senator Burr. Dear Senator Burr, this letter is to convey to you my concerns about the American Health Care Act as a North Carolina physician. I lived in this state since coming to the area as a military doctor in 1996 and have primarily worked in a hospital-based internal medicine practice since 2000. Practicing at New Hanover Regional Medical Center, I am privileged to care for the uninsured and underinsured of the area, along with the insured patients seen by the primary care physicians of my practice. It has been my repeated observation over the years that the citizens of our area who are uninsured are apt to suffer from consequences of undiagnosed preventable disease in a way that we rarely see in more affluent members of our population. This observation has been borne out in estimates by the CDC of higher death rates for many diseases based on socioeconomic status. Personally, I can easily tell you stories about patients presenting to me late in the disease process. A 64-year-old woman who spent most of her life working as a maid who presented with advanced breast cancer, never having had a mammogram or access to quality primary care services. A 53-year-old construction worker unable to afford insurance presenting with untreated hypertension and stroke, with a wife and teenage son looking on. A 60-year-old gentleman who'd never had a screening colonoscopy presents with advanced lung cancer. What these patients have in common is that they never had access to quality primary care services or relationship with a primary care provider. For most of these people, this means that medical care becomes something to be avoided unless an emergency arises. As you know, the Affordable Care Act sought to remedy this situation by expanding employer-based insurance, creating a mandate for individuals to enter the insurance marketplace, and expanding Medicaid. Although the ACA has expanded health insurance to over 20 million of the previously uninsured, it has obvious setbacks to various degrees in many states due to rising premiums, weaknesses in the marketplace due to lack of competition, and failure of an effective mandate for the young and healthy to buy insurance. As a physician who sees the ill effects of access to healthcare, lack of access to healthcare, I implore you to get behind pragmatic legislation that crosses partisan lines to truly expand health insurance to all Americans. The ACA is very likely to do exactly the opposite, a position that is shared by the American Medical Association and the American College of Physicians. I strongly believe that our citizens are deserving of access to basic preventative health care services at a cost based on their means, a relationship to a primary care provider, and insurance adequate to prevent financial disaster in the event of the need for catastrophic care. Surely finding a way for all Americans to have health care and join the community of advanced countries who have accomplished this already would be a measure of our greatness as a nation.
Woohoo! Thank you, Dr. David Schultz. You guys rock.